name is Dr. Cynthia Shaw. I'm a licensed clinical psychologist and owner of Authentically Living Psychological Services. I'm going to be talking a little bit about some of the services that we offer and the individuals that we just love to work with. And one group of persons or an experience that we very much enjoy working with and are pretty keen in working with is self-esteem. So people who are struggling with low sense of identity, poor self-compassion, negative self-thoughts, poor self-views, self-harm behaviors, maybe thoughts of suicide have come up in the past. We really enjoy working with those individuals. As existential, holistic, and trauma-informed therapists, we take a person-centered approach when working with such individuals. And really, a lot of the space is processing where some of this self-hatred came from, right? It didn't come out of nowhere, right? Did it come from messages that were shared to you when you were younger? Is it sensitivities to comparing yourself to other people in your current surroundings? Is it perfectionism, this high expectation that you have of yourself? Is it from poor mistreatment from partners and peers and other people in your life? Where did some of these messages come from, right? That is really very foundational to some of the work that we do when first starting therapy and processing someone's self-esteem. When we have a better understanding of where these messages are coming from, we really get to tackle them a little bit, right? Is this the relationship that we want to have with ourselves? How do we create a relationship that is more harmonious, more loving, more self-accepting? And so a big area we find is also having to focus on identity, right? People who often have a low sense of self or poor self-esteem don't necessarily know who they are. Maybe they rely on others to tell them information about themselves. They look to others to answer questions, because they don't respect or value their own opinions or own judgments or own belief systems. And so a lot of the time is spent navigating a person's own identity, right? Their interests, their values, what is important to them, what's not important to them, and really validating that person's curiosities through these conversations, right? We want to make space for a person to be able to explore different facets of who they can be, right? Because you can really be anyone, right? And all of that is still authentic. And so creating spaces where a person feels safe enough to explore different facets of who they are and who they want to be. And hopefully from there, being able to express that a little bit more freely, right? Going out into the world and wearing this, very bright colored shirt just because they like it, right? And it doesn't matter what anyone else thinks. And I often find that when that energy is expressed, people are returned that same energy, right? Their relationships develop. They can create more meaningful, depthful, oriented relationships and friendships and romantic relationships. And then that just has like the cyclical effect of like, I feel good about myself. I'm expressing who I am. That energy is getting returned back to me, and I'm creating relationships that lift me up, right? I'm no longer accepting people and messages that are not validating to me, right? And I'm no longer accepting harmful messages from other people. People who struggle with self-esteem might fall into one of these camps or have one of these identifiers, but not necessarily so. A lot of times teens and adolescents struggle with self-esteem. They're kind of coming into their own. They don't know who they are. They're feeling really awkward, comparing themselves to other people. So being an adolescent is a very challenging time and often comes a lot of low self-esteem and questions of identity. Periods of life change, moving to a new city, starting a new job, getting a promotion, even though all those things sound really fun and promising, can actually bring a lot of insecurity, right? There's insecurity with the unknown. As human beings, we like predictability. We like to know what's going to happen next. It's part of just our functioning and our biology. And so during a period of life change, we have no idea what's going to happen next, right? And with that, our feet might feel a little wobbly and we might start to question ourselves. Totally normal. People who have experienced significant trauma, abuse, torture, anything within that realm, of course, will question their sense of self and their identity and who they are. A lot of the times, people with chronic illness, terminal illness, can also struggle with self-esteem because they may compare themselves with other people, right? I'm a young person who should be functioning appropriately, but here I am chronically fatigued and not able to keep up with my peers, and hence that can bring up some low self-esteem and poor self-care. So these are just a few examples of individuals who might struggle with self-esteem, but you might not fall into any of those camps and still struggle with self-esteem. But those are just some examples of some individuals who may struggle. So if you find yourself falling in one of those camps, or anything that I'm saying is resonating with you, or you're kind of curious, like, you know what, I kind of have a little bit of an understanding of who I am, but I think my self-esteem can be improved in one or two areas of my life even. I'd like to feel a little bit more confident. I'd like to practice being a little bit more outgoing, feeling more comfortable in my skin. Any of those things, please feel free to reach out or inquire more. Our website is authenticallylivingpsych.com. We have tons of different contact forms throughout the website, or you can send us a message at 312-600-3775.